How do doctors read brain waves on an EEG for epilepsy? Imagine trying to listen to a busy city's sounds to figure out if there's a pattern or a strange noise. That's similar to what doctors do when they read brain waves on an EEG for epilepsy. An EEG, or electroencephalogram, is a test that records the electrical activity of your brain. It's a safe, painless, and non-invasive way to help diagnose epilepsy and understand seizures better. First, before the test, you might be asked to avoid caffeine or get less sleep. This helps make abnormal brain activity more likely to show up. During the test, small metal discs called electrodes are placed on your scalp using a special conductive paste or adhesive. These electrodes detect tiny electrical signals produced by neurons, or brain cells, as they communicate. The signals are sent to a machine that amplifies and records them as wavy lines on a computer screen. The entire process usually takes about 20 to 40 minutes, but longer recordings can be done if needed. When doctors analyze the EEG, they look for specific patterns that are associated with epilepsy. These patterns are called epileptiform discharges. They often appear as sharp spikes, spike and wave complexes, or other distinct shapes that stand out from normal brain activity. Normal brain waves tend to have a regular rhythm, but in epilepsy, there may be sudden bursts of abnormal activity even when the person is not having a seizure. Sometimes, doctors ask patients to do certain things during the test, like flashing lights or hyperventilating, to see if these actions trigger abnormal brain waves. It's important to remember that not everyone with epilepsy will have abnormal EEGs all the time. Some people may have normal results, especially if their seizures are infrequent or if they are taking medication that controls their seizures. In such cases, doctors might repeat the test, perform a sleep-deprived EEG, or do an ambulatory EEG, which involves wearing a portable device at home over several days. This increases the chance of capturing seizure activity or abnormal patterns. Interpreting an EEG requires a trained specialist, usually a neurologist or a clinical neurophysiologist. They carefully review the recordings, distinguishing true epileptiform activity from normal variations or artifacts caused by muscle movements or external noise. They look for specific patterns that suggest epilepsy, but they also consider the patient's medical history, symptoms, and other tests like brain imaging. Sometimes, an EEG may be normal even if the person has epilepsy, which is why it's just one part of a comprehensive diagnosis. The information gathered from an EEG helps doctors determine the type of epilepsy, guide treatment options, and decide whether it's safe to adjust or stop medications. For patients being considered for epilepsy surgery, EEG helps locate the exact area in the brain where seizures originate. However, it's crucial to understand that EEG results are not definitive on their own. They are combined with other clinical information to make an accurate diagnosis. In summary, doctors read brain waves on an EEG by placing electrodes on the scalp to record electrical signals from the brain. They analyze the patterns for signs of abnormal activity that could indicate epilepsy. While the EEG is a powerful tool, it's important to remember that results can vary, and a normal EEG does not rule out epilepsy. Always consult healthcare professionals for personalized advice and treatment. Understanding how EEGs work can help reduce anxiety and set realistic expectations for what this important test can reveal about epilepsy and seizures.